And welcome back. This is Daybreak on Citizen TV with some health tips now for you. We're going to be talking a little bit about cosmetic dentistry, and I have a dentist who's brought his tools of the trade. Go ahead and introduce yourself, doctor.
Thank you very much. My name is Dr. Peter Irungu. I'm a dentist or a dental surgeon at Hygiene Dental Clinic within Nairobi, and I'm a graduate of the University of Nairobi with a bachelor's degree in dental surgery. Okay. So that's my area of specialization. Yeah. Yeah.
Now, when we talk about cosmetic dentistry, or like the aesthetics of it, it's something that, you know, is supposed to improve your look, but not so much functionality. Would you describe it that way?
Right. Yes. Aesthetic dentistry or cosmetic dentistry, it's basically about your looks. Because your mouth and your teeth form part of your face, which is more related to aesthetics. So there's a lot about that your teeth can tell, especially from the other person's perspective. First of all, the alignment of your teeth means a lot, because generally your mouth should be well aligned, although we have a number of good cases where the teeth will always lose their alignment. There's what we call crowding, which affects much about aesthetics, because I think you've ever seen someone, maybe their teeth, some people will say that you look like you have more teeth than,
than you should.
Than you should. Yeah. While basically that person has the same number of teeth, just like the other person. The only problem is that sometimes the jaw size is a bit smaller, and the tooth size, or the total tooth size, becomes more than the size of the jaw. So what happens as the teeth erupt from a young age, you find that the first teeth to erupt will align themselves well, but the ones that come in later, they find. Are we
talking wisdom teeth here? Because I know that can be an issue for some people in terms of overcrowding.
Not really the wisdom teeth, because the wisdom tooth is well hidden at the back of the jaw. We are talking about the canines. Actually, the canines are the sharp teeth at the corner of your mouth. The canine teeth happen to be among the last teeth to come into the mouth. They come in from around the age of 12 years. And you'll find that most of the other teeth, the central incisors and the premolars, have already come into the mouth. So by the time the canine is coming in, it will find that, oops, everyone else has occupied all their space, I have nowhere to go. So what does it do? It pops out over the others. And that is when it looks like it's an extra tooth. But in real sense, it's just a normal tooth, but without anywhere to sit on the jaw. Yeah. So that really affects aesthetics in a great way. And you find that most people, especially from the adolescent age, and that is the time when it starts to manifest, they'll always tend to be shy. Their self-esteem will go a bit down. And therefore, we always encourage parents that if you notice your child has that kind of arrangement, it's called crowding, please visit a dentist so that you are able to get a solution, because that child may be affected permanently, because they don't want to associate with the other children, they don't want to be free, they don't want to be outspoken, because they fear that everyone is laughing at them, everyone thinks their teeth are bad, everyone thinks they have extra teeth. And it's a very simple problem to correct. First, I would like to warn our viewers and our parents that don't rush to, let's say some parents will always tell the dentist, like, no, I want this tooth out, it's an extra tooth. And unfortunately, if you're not in a professional setting,
you can't make that decision.
Not even that. If you tell someone who is not really a professional that just remove this tooth, it's an extra one, they'll go ahead and do it. Unlike a professional dental surgeon who will tell you, wait a minute, we are not supposed to lose this tooth. Because what happens when you remove your canine, you lose your lip support, because your canine at the corner of the mouth, it's quite a huge tooth at the corner. If everyone palpates the corner of their mouth, they'll feel a huge bulbosity. That is what supports the corner of your mouth. So if you lose that canine, your lips will sink in. And that automatically changes your aesthetics. It changes how you smile, it changes how you talk, and a lot. Even what happens, some parents will even remove one tooth from one side and leave the other one on the other side. So what happens, we get what we call drifting. The tooth that has been removed will create some space, some little bit space, and the teeth on the other side will decide, let's move towards that side. And then what happens when you talk, your center line will be deviated once, as you talk, you can tell your center line between your eyes, between your nostrils. It goes all along between your central incisors. So if there's drifting, you realize that it's very easy for someone to notice there's something wrong with their teeth just because a tooth was removed on one side.
Wow.
So we would...
like you're saying, again, most people don't understand the complexity involved in this and might just think it's, taking a tooth out, but like you're explaining here, it's quite complicated.
Very complicated. And unfortunately, it gets more complicated now when they visit a professional dentist after the tooth has been extracted and they want their smile line to be back. They want their midline to be back. And it's one of the most complicated procedures a dentist will ever want to see. Wow. Because once you lose it, regaining it is the hardest thing. So we encourage parents, don't take that step first. Visit a dental surgeon, visit a qualified dentist who will advise you. There are many ways of addressing that. Mostly we do it by way of braces, what we call fixed braces.
You have an
we have some demonstration here. Fixed braces are some appliances that are fitted on your teeth. They'll normally be fitted on quite a good number of your teeth, in as much as maybe one or two of your teeth will be the ones out of line. So you have to fit it on all teeth because the ones that are straight are the ones which will help the tooth that was not straight get into line. So some parents may be wondering, why are you talking about fitting braces, a whole mouth and only one canine is out of line? So fixed braces are fitted in such a way. They have to be done by a qualified person, a well-trained orthodontist who does that, because it involves application of mild forces onto the tooth by way of, one, the bracket. The metal brackets are the shiny brackets you can see, although we also have some white ceramic brackets, not the wire. There's a wire running along. So just take off the wire and look at what you can see. There's something stuck onto the tooth. That is called a bracket. A bracket is well designed with some grooves here and there, and it's well calibrated in such a way that when fitted on a tooth and properly positioned, then you're supposed to use a wire that runs along all those teeth.
In terms of maintenance, when it comes to braces, what is the upkeep like there, and how often should someone visit the dentist, or just in terms of cleaning as well?
Okay, it gets a bit challenging when you have fixed braces because, as you can see, you've interfered with the surface of your tooth. So someone should be very careful with their brushing. They should take a lot more time than in normal circumstances. They should use some special orthodontic brushes which have a few bristles that are able to penetrate in between the wire and the bracket, so that it can remove whatever is stuck in between. They also, according to the dental surgeons or the orthodontists' appointments, you're supposed to visit at least once a month, so that they can have a look and change a few things here and there. If there's some accumulation of plaque and food stuff, they can be cleaned. So once you have these braces, you're supposed to be very close to your dentist because you should not just disappear with them.
Yeah, just get them and sort of... Yeah, and you know, for a lot of people, like you were mentioning, get these during adolescence.
Yes.
But, you know, there might be people who have issues going on with their alignment but are not able to afford them, because I know this can be quite expensive.
Yes, yes.
So what do you advise someone who is in that situation?
Okay, the first thing is that despite the cost, it is worth, especially as I've said about self-esteem. And so for the parents, it's quite
Perhaps we can give a ballpark figure of how much it costs to get braces in this day and age.
First of all, it depends on the severity. We have different we have categories of the crowding. So the cost might range, but it might be to the tune of a six-figure. Although if your problem is not so complicated, maybe you can find a dental surgeon or an orthodontist who can do it at a lower price for simple or mild crowding. But the more complex it gets, the more the figure increases. But it's a slow process, so I'd like to encourage people that most of the places, the practitioner will charge you over a period of time. So people should not fear much. You should not stay with them in that position.
It's not a one-time fee, because as you mentioned, if you're going to see your dentist every month.
Yes.
So, and it's, for some people who've had them for years.
Although they should not go for so long. They should not go past anything like 2 years.
Okay.
Most of the times, if it goes beyond that, it starts to cause some detrimental effects on the teeth.
Okay.
So if it's going for too long, maybe something is not right. Maximum maybe 2 years for very severe cases.
Right.
But to be 1 year to 2 years, at least there's a good time frame for someone to be able to afford most of the charges for that.
Let's talk about what this is about here.
Okay. This model here illustrates the difference between healthy gum on my left, if you draw a center line at the middle, and some gum disease on the right, what we call periodontitis. This is a very dangerous disease. I always like to notify my friends, my clients, our viewers, that gum disease is irreversible at a particular stage.
Wow.
And that is what causes tooth loss in most of the elderly or middle-aged individuals. It's a slow-occurring disease, which occurs because of what we call plaque accumulation on your teeth. Plaque is a biofilm, or it's a mixture of saliva and bacteria and some foodstuff that normally lines your teeth. Every time you brush, it will only take 5 minutes for the plaque to come back. So everybody has a degree of gum disease at every moment.
Wow.
What
that's
matters?
scary.
Yeah, what matters is the severity. If you keep brushing well, and that's why we always insist on good toothbrushing and visiting a dentist regularly, it's because we need to remove the plaque before it calcifies and forms what we call plaque. Plaque are the black stuff you're seeing at the gum level. Yeah, that is the second phase of the gum disease. When plaque calcifies, it forms a hard stone. That hard stone pushes away the gum. It causes the gum to inflame, and the gum starts bleeding easily. The gum starts moving away from the tooth. That's what we call recession. And your tooth starts looking longer. You can see some of these teeth are looking longer. And then at a particular point, your mouth will have some pus and bad breath, and that is the chronology of events that leads to the tooth loss. And that's why you find that most elderly people, their teeth will either be shaking or longer than normal, and sometimes they'll talk to you and you'll want to run away. Why? Because the gum has been so damaged. And this is a slow occurring disease. It starts from adolescence. If you don't visit a dentist, by the time you're age 35 to 40, you've already developed good deposits of
Well, that's important to know, because when I look at that, immediately in my mind I'm thinking, oh, this person was a smoker or what have you, but that's not
the case.
Yeah.
This can happen to you. It could be happening to most of the viewers, and you might not know until the symptoms hit you hard. Like you find that you can't bite on a piece of bread because the tooth is shaking, and that's when you start worrying, like, what has happened? That disease has been going on for like 20 years because, as I said, it's a slow occurring disease. And I said it's irreversible at one point, because you might come to the dentist when your tooth is shaking so much that the only option is to get it out.
And do you find that's the case a lot? Because I feel like with dentistry, it's one of those professions where people come to see you when it's too late sometimes. Like, until you have a problem, most people don't think, I need to go for a checkup or for cleaning or for what have you.
Yeah, it does happen. But the good thing about gum disease is that it will take you to hospital a bit faster than a cavity. When you develop a cavity or you have a tooth decay, you'll get severe pain, especially at night. That is what we normally get to see. But for the gum disease, we normally see people when they are at not a very bad stage, where they have some gum bleeding, they have some bad breath. At least the disease won't have advanced so much, and at that point it's easy to just clean your teeth, remove the tartar, and your tooth will just become firm and your breath will go back to fresh.
Yeah, you talked about bad breath. Is that halitosis? Is the
yes, that
is the medical term?
That is a medical term we
and
use.
This is caused by plaque, just solely plaque, because there's some people who have this disease and are not aware.
Yes.
So what is it caused by? Is it something that you can get rid of?
Yeah, halitosis will be part of the sign that we pick when you have severe gum disease. That's called periodontitis. Because as I explained, your gum will get swollen because of a lot of bacteria hiding in the gum, and then it will produce some pus, and that is what will give you mostly that bad breath, that halitosis. And it's something that once you visit a dentist and we ascertain that it's indeed coming from your gums, it will be possible to clean it and it will just disappear. Although we have another version of halitosis, which is kind of psychological, that also is a headache to us as a professional, because someone will come into your clinic, their mouth is clean, they've had some regular cleanings, but they still insist they have some bad breath. It is so disturbing, because we will try to convince you that indeed there is none, because even the dentist cannot pick it. But in your mind, you've already set it that you have halitosis. So it's found in quite a good number of people, although not many. and that is normally a bit complex because it's now psychological aspect. We have to tune you psychologically that you are good, because that person believes every time they talk to you, you are turning away because of bad breath, and maybe you are turning because you want to see something else around. So that is the only aspect of halitosis that can give us a headache. But the rest of it, from the gum disease, it's very manageable at the dental office, and it will just disappear once your teeth are cleaned well and you maintain good oral hygiene. Good oral hygiene is maintained by brushing at least twice or thrice a day.
This is quite a large toothbrush you got here.
Yes, this is for demonstration purposes. At least maybe this one can only be used in carnivals or such. But we use it for demonstration so that we show you how your toothbrush should be. Your toothbrush is only functional if the bristles are straight, as straight as they are. Once they start bending...
I'm glad you brought that up, because I've seen some toothbrushes that have seen better days. And maybe you can tell us what is the correct amount of time to keep a toothbrush.
Yeah, the correct time to keep a toothbrush is as long as the bristles are straight, because it will depend on the quality. Earlier they used to give it 3 months or a few months, but due to the quality changes, it's hard now to fix it on months. Because you might tell someone to do for 3 months, and maybe after 2 weeks the bristles are all mixed up, so it doesn't even add value to your toothbrushing. So the best thing to check is the bristles. As long as they're straight, they're not bending outwards, they're not they should always be straight. You can continue using it. Of course, over time, you can always tell when your toothbrush starts wearing off. You can feel like the way it was when it was new, like last week, is not the way it is. You can always tell the effect of brushing. After brushing, you can run your tongue along your teeth, and you can tell, oh, yeah, I can feel everything is off, the plaque is off. But if the toothbrush has started wearing off, you'll realize that you'll run your tongue, and you'll find that you still have some plaque, a slimy layer on your teeth. Then maybe that is the time to change your toothbrush. About the quality, that is personal. It depends on what you prefer. But mostly is the bristles. Something I would like to mention.
Are straight.
Yeah, something I would not like to forget. There's some people who believe that the harder the toothbrush, the more the cleaner it will make your teeth be, and that could be the reverse, because the harder the bristles, the more it might wear off your tooth. We get what we call abrasion. We've seen people who really get the hardest toothbrush, and they use all the force they can use with their hands to press the toothbrush on the tooth. So what happens? It eats away the enamel part of your tooth, especially at the junction between your gum and the crown. It's called the CJ. It's normally a weak part, and the more you brush it with a hard brush, the more you wear off, and then you start developing sensitivity. You can't take something, you can't take some cold water.
Cold drinks.
Because you've exposed the tooth. Actually, it reaches a point you can't brush now again. So the problem now will multiply, and it's a roller coaster, because now you'll start getting gum disease. The sensitivity is there. The abrasion will develop into a cavity, and then you'll get pain. So let's avoid using the hard toothbrushes. Just use the texture that you feel is comfortable for you. Medium is the best. Soft is for people with severe gum disease, awaiting the progression of their healing after treatment. We always advise them, or people who've undergone some oral surgery, whereby you don't want to tear the tissues that are healing. Maybe those ones can use soft, or some young children maybe who are going through some viral infections of the mouth that normally manifest with some oral ulcers.
But otherwise, medium is advisable.
Yeah, medium is the best, because it will do the
Finally,
function.
Glass mold here.
Yes.
Explain what that is.
This model is just an illustration of how your teeth are aligned. You can notice the others were not showing us the root. So we've made it clear for you here. So you can see each tooth has its own root. And we have the front teeth always have one root each. But then once you start getting at the center, the premolars, you occasionally get 2 roots or so. And then the molars, most of them will have 3 roots, especially the top ones. The lower ones will always have to have 2 roots, you can see on each tooth. So a tooth is not just what you see when you smile. That is just part of the tooth. That's just the crown. And it's only maybe a third of the length of your tooth. So when you maintain your tooth, just know that you're maintaining a lot more than what you can see. So the roots, that is where the nerves are harbored. They're normally at the center of the tooth. We have a central canal. And the demonstration here indicates maybe when you develop a cavity, it progresses slowly into the dark line at the center. That is the pulp chamber and the root canal. So an infection will normally develop there, and that is where some pain develops, and that is, people are conversant with that. A toothache is one of the worst pains of the body.
It actually is.
It is, yeah? Especially when it gets there to the top of it. So the infection will always progress downwards, and if it's left unattended, it will form an infection at the end of the root. You can see some yellow ball at the tip there. That's called a periapical infection. That normally comes after years of neglect of a cavity. So for those people who are good at saying, I have a cavity, but it's not paining, so let me wait.
There are people who say, I can't eat with this side of my mouth.
Yeah, but I'm okay for now.
I'm okay.
Yeah, I'm not in pain. Just know that you are risking losing that tooth, because once you develop that periapical infection, it will later on progress to maybe a swelling, a facial swelling, an abscess formation. People can really get serious life-threatening infections just because of a tooth, because some of the infections can travel all the way to the throat, and they can block your throat and you can't breathe. And if you're not attended to within maybe 6 hours, 12 hours, you might pass on. So let's not assume dental problems. Cavities, gum disease, let's not wait for too long, because the longer you wait, the more the body gives up on fighting back. When an infection starts, your body will always try to fight back, and that's why the pain will come and go. The pain will come and go, but at a particular point, the body will say, now it's over, and it will just let the pain reign. And that is the time maybe most of the people will run to the dental surgeon's office, and maybe things are too
maybe it's too late for any type of reversible action to be done.
Yes.
Wow.
So it's
I've learned so much, Doctor.
Thank you, thank you.
I really have. For people who are interested in maybe getting in touch with you or where you're based, maybe you can share that information.
Yeah, you can just search for us, Dr. Irungu Peter, dental surgeon. Our clinic, Shine Dental Clinic. It's on Facebook, on Twitter, hashtag Dr. Irungu, and our clinic is within Nairobi. You can find it along Jogoo Road, Maziwa Stage, and maybe if you want to contact us, you can get us on 0710 86 0006, 0710 86 0006. Our website is on www.shinedentalclinic.com, but on Facebook you'll find a lot of teachings. We do them every day, and any question you ask on Facebook, like our page, Shine Dental Clinic, and you'll learn more from that.
Yeah. I definitely learned a lot in just a couple of minutes, so I'm sure that your online platforms have an equal amount of information. Thank you so much. We've been talking about cosmetic dentistry this morning, but just for someone watching, just a parting shot, if there's one thing that you could tell Kenyans in terms of improving their smile or improving their dental habits, what would that be?
I normally insist that your teeth, they perform many functions, not just biting. Actually, when we were back in university, a lecturer used to tell us, they're actually even weapons. So if you are two of you and one has some teeth and the other doesn't have, and you attack maybe by someone or an animal, the person with the teeth can bite something off that attacker, and maybe because of the pain they might be free. But what happens unto you who just have the gum and no tooth? You'll be left attacked. Yeah. So your teeth play a very important role. Let's maintain them. Let's visit a dentist every 6 months or every year once. Make sure you visit a dentist, because you'll never know when the problems are ticking. You'll never know when the problems are coming up until you visit a dentist. As I've said, most of them, the symptoms are normally very mild as the disease starts. The symptoms will worsen as it progresses, and sometimes it's too late. It's also worth noting that we have oral cancers, so October being a cancer awareness month, let's be careful, because some of these infections, some of these swellings we ignore within our mouth, they could turn to be cancerous. There could be some cancer in the making, and all you're saying is that I have a tooth that is painful, I have a swelling that's not going away. Please rush to the dental surgeon. At least you better be told, no, you're good. There's just some things that will clear.
Better to be safe than sorry.
Yeah, it's better safer than sorry.
Yeah.
So let's make dental surgeons our friends, and you'll keep your smile until the last day. I always insist you should have your teeth until the last day. From the first tooth to the last on the 32nd, although not everyone has 32, but it's not a problem.
Become friends with your dentist, okay? Dr. Irungu, thank you so much for coming by this morning here on Daybreak. We've got much more coming up. Time for a short break. We'll be right back.